Vital Signs Unit Lecture, Part 1. Vital signs reflect a person's state of health and hemostasis. The cardinal signs when we talk about vital signs is temperature, pulse, respirations, and blood pressure, oftentimes referred to as TPR and BP. Anthropometric measurements are considered the following: height, weight, BMI, head circumference, chest, waist, and neck circumference, and any other body measurement. Oftentimes we do head circumference in infants up until 36 months old to detect hydrocephaly or microcephaly. We oftentimes do chest circumferences to evaluate patients with emphysema. Waist circumference has become more popular recently with insurance companies and their annual wellness visits and checkups for patients. They will oftentimes require a waist circumference to be taken. And neck circumference is a measurement that we sometimes take with patients with sleep apnea. Vital signs, even though you will do them routinely, it is essential that you do them accurately. These indicate a change in general health. Treatments are based on vital signs, and it is crucial to get the correct diagnosis. If you record a vital sign that has elevated blood pressure, that could indicate that that patient is going to start medications or go through coaching of lifestyle changes. If this was incorrect, neither one of these could possibly be needed. You should never be careless or indifferent about taking vital signs simply for this reason. Baseline vital signs: it is important to get a baseline, an average or usual numbers for patients. This is particularly important to do during well-child checks or annual wellness visits for patients, so we can compare them when they are sick. Oftentimes when people come in sick, their blood pressure might be elevated, their temperature might be elevated, or their pulse might be decreased. Those sorts of changes happen when we are sick or have an illness. Vital signs charting: we often abbreviate blood pressure with BP, and you will have the systolic number, which is 120, over the diastolic number, which is 80, and then you will want to record which arm, in this case it's the left upper arm that we took the blood pressure in, and whether the patient was sitting, standing, or lying down. Pulse is recorded in the number of beats, so in this case it was 80, and then you always want to put beats per minute, or BPM, often abbreviated as. Respirations, in this case, is 16, and we always record respirations per minute. And then temperature, in this case, is 98.6, and then we want to record whether it was Fahrenheit or Celsius. Most places prefer Fahrenheit, and you should be able to do the conversion between Fahrenheit and Celsius. Vital signs: it is important to use good aseptic technique even though it is not an invasive procedure. Studies show that bacteria spread from one patient to the other via healthcare workers' hands after vital signs were done. Aseptic technique: clean your equipment before doing blood pressure, clean earpieces, clean the diaphragm and bell of the stethoscope with alcohol wipes, and clean the blood pressure cuff or sphygmomanometer with sandy wipes or something of that nature. Aseptic technique: so clean your earpieces and the bell and diaphragm. Here's a picture of some bacteria that had grown off of some swabs from someone's earpieces. And this is the growth that we got after we alcoholed those earpieces off, those very same earpieces. So this shows that it is really important to use those aseptic techniques. Here's a blood pressure cuff before cleaning. Oftentimes in the clinic, blood pressure cuffs are the most neglected piece of equipment as far as cleaning. A lot of times we will clean the bell of our stethoscope, but we'll often neglect our blood pressure cuffs, so this just shows how important it is. After cleaning, very few bacteria, actually this is just environmental mold that got into the medium before we incubated it, so that isn't even relative to the blood pressure cuff that we sanitized. So which one would you want to use on your family or loved ones? Obviously the cleaner ones, I would hope. Temperature. Body temperature is a balance between the heat loss and the heat produced by the body and is measured in degrees. The increase in body temperature is thought to be the body's defense reaction to inhibit the growth of some bacteria and viruses. Factors that affect temperature are age. Temperature of infants and young children fluctuates more rapidly. Aging adults are more susceptible to hypothermic or hyperthermic reactions. Stress and physical activity increase the metabolic rate, causing an elevation in temperature. Women have fluctuations of temperature throughout their menstrual cycle. Smoking, drinking hot fluids, and gum chewing can temporarily elevate an oral temperature. This is why it's very important to ask patients when you take that oral temperature if they've had anything to eat, drink, smoke, or chew gum or exercise in the last 15 to 20 minutes prior to taking that temperature. If they have, we should choose a different method of taking that temperature, or the alternative would be to wait to take that temperature. Fever, febrile, or pyrexia are often the terms that we use. A continuous fever rises and falls only slightly during a 24-hour period but remains above average or normal range. Intermittent fever comes and goes, or it spikes then returns to average range. Remittent fever has great fluctuation but never returns to the average range. It is a constant fever with fluctuating levels. Temperature considered febrile, so rectal, temporal, or auroral temperatures over 100.4 Fahrenheit, oral temperatures over 99.5, auxiliary temperatures over 98.6. Fevers of unknown origin is a fever over 100.9 for 3 weeks in adults and 1 week in children without an unknown diagnosis. Auxiliary temperature are approximately 1 degrees Fahrenheit lower than the accurate oral reading. Tympanic or auroral or ear temperature is an accurate method because it records the temperature of the blood that is closest to the hypothalamus. A TA reading is more accurate than a tympanic measurement for identifying elevated temperatures in infants. Pediatricians may prefer either rectal or temporal artery temperature on infants suspected of having a high fever. Care must be taken with rectal thermometers because of the possibility of rectal perforation. So infants should really only have temperatures taken either by a temporal artery unit or a rectal unit. So types of fever again. Continuous, fever above patient's average, fluctuates less than 3 degrees. Intermittent, comes and goes. Remittent, fluctuates considerably more than 3 degrees and never returns to the normal range. Types of thermometer. There are the digital types of thermometers, and these are for oral and rectal. The oral will have the blue tops on them, and the rectal ones will have red tops. Tympanic membrane thermometers, a temporal artery scanner, and then the auxiliary usually are the little strips, and then we read what the temperature is. Or you can use some of the oral thermometers can also be used in the auxiliary, and we just need to make sure that we come in contact with the direct skin and we have the armpit closed as tight as possible.